For the first time in 43 years, the World Health Organization came to Guam for their regional meetings. But one day removed from the end of those meetings, and Dr. Vivian Lin says that Guam will go down in history. PNC's Tim McHenry has more. Tim?
Thanks, guys. As the World Health Organization's regional meetings complete this week and the representatives from each country prepares to leave Guam, we're left to contemplate some of the messages on the agenda for the World Health Organization. We talked to Dr. Vivian Lin to find out more about why Guam will go down in history in regards to universal health care. Here's the story.
The fact that we actually adopted a framework for universal coverage in Guam means that Guam will go down in history, as this is where universal health coverage became a regional framework.
All week long, the World Health Organization officials tackled many serious health issues that plague the Pacific region, including tuberculosis and viral hepatitis, to name a few. Guam, however, poses a unique issue in terms of health coverage because of its exposure to tourists from all over the world. This gives Guam a diversity of populations that would need health coverage. Dr. Shin Young Soo, Regional Health Director for the World Health Organization, echoed this thought at the opening ceremonies earlier this week.
The health sector alone cannot solve every aspect of these issues, but we still must take the lead in motivating actions and guiding collaboration and cooperation. Our main agenda this week includes critical issues such as viral hepatitis, universal health coverage.
Dr. Vivian Lin, who thinks everyone should have access to health coverage without financial hardships. But the diversity of healthcare systems in the Pacific region is a challenge. The framework for universal coverage preaches collaboration and cooperation among nations in the Pacific region. In some countries, Dr. Lin says they have resources but big out-of-pocket payments. In other countries, they have fully government-supported health services, but resources are limited.
This means that we're no longer in a situation when we have communicable diseases where people get sick once, they get treated, and they're home and they're done. But with non-communicable diseases, people have ongoing contact with the health system. So we really have to think about what's the outreach model. How do we get all the different disciplines working together? And how do we make sure that the families are part of that care decision-making process? This means a change in the service model.
For PNC News, I'm Tim McHenry.